I first meet a family, it's usually when their child is critically ill. And the first thing I say is that we are your child's team. Your child is at the center.
From the referral, through the evaluation process, through the transplant, and then postoperative care, we encourage the families to be involved.
We start as soon as we know that we're headed in that direction with an educational process. What is a transplant? What is the surgery involved? What are the risks? What are the benefits? What it's like being on a waiting list. All of these are things that we try to incorporate in our usual care for the families.
Children are not small adults. Unless you're completely involved with the care of children, you tend to say, well, let's write the prescription and they'll take it. And you don't think about things like trying to get that dose in during school time just isn't going to work.
I think one of the unique things about children's is that we do our best to avoid transplant. And if you can undergo treatment or receive some sort of medication that can avoid a transplant, we are 100% for that.
It's on our shoulders to protect the patient from any undue events, and I think we always take extra care making sure that the patient is at the right point in their life to get that transplant.
I think that one of the fundamental missions of Children's Hospital of Boston is really clinical innovation. While we focus on taking care of children, we're always striving to do so in a more innovative fashion.
Transplantation, I think, more than anything, is a multidisciplinary service. None of us could function without the other members of our team, from the surgeon, of course, who does the surgery, to the physicians who take care of the children before and after transplant in the hospital, the inpatient nurses, the outpatient nurses, the social workers, the nutritionists, the psychologists. Every one of them, I think, is critical to the situation.
Having all those people around can really help us kind of take care of patients and get them the specialist care they need in a way that one person or two people can't do.
We have music therapy, we have pet therapy, we have the art cart come around, we have tutors that come in and offer tutoring services to patients when they're at missed school to keep them up to date. Getting them up and moving really helps, not only so we can heal them physically, but also heal them spiritually and emotionally.
I want them to be back to school. I want them to participate in their activities. I want them to go on their camping trips with their friends and play sports. That's what we all strive for, to achieve a normal childhood for our patients.